You know, guys, every time when I listen to the comrades, I get a headache. And it's because of the things that the comrades say and the solutions that these people sometimes come up with. They are ridiculous. And today, it's not your day because I want you to listen to the Minister of Health, Motsoaledi, basically admitting that our public healthcare facilities are overburdened. This is what the minister has admitted on this clip, that our public healthcare facilities are overburdened. And we know that the public healthcare facilities are overburdened because of the illegal immigrants. We know the open border policy of the ANC is the reason why we are dealing with this issue that we are dealing with today. But instead of these people basically saying that we need to push the illegal immigrants out, because right now we are facing a situation where South Africans go to the clinics, they go to the hospitals, and they cannot get help because the beds are full of illegal immigrants. And this is a fact. This is not something that we are just making up. We know that this is a fact. But no, this is not what the ANC is pushing for. They are not pushing to get rid of the illegal immigrants, but they want more money to build more hospitals. They want more money for more resources, as if getting more money and building more hospitals, it is going to make the situation better. They are pretending like if they get more resources, it is going to make the situation better. But the word is out in Africa that if you go to South Africa, you're going to get grants, you're going to get free healthcare. The word is out. The word is out. And instead of these people doing what is noble for this country and saying that, guys, we need to put and push our immigration laws. We need to get rid of the people that are not supposed to be in this country so that our public healthcare facilities can actually breathe for a moment. They are saying, no, we need more resources. We need more money, meaning that the taxpayers of this country must continue to pay for the health care of the people that are jumping the borders and coming into this country to abuse our resources. This is the solution of the ANC. Completely unbelievable, man.
But, if we're looking to the issue of overcrowding as well and healthcare services, it's become a controversial issue here in the country. And I wonder if you could talk to us about, these new hospitals, how they're going to be addressing the issue. Perhaps give us a sense of how dire the situation is in regard to overcrowding and why government's now seeking these alternatives to prevent problems for the near future and beyond.
Yeah, well, Lizelle,
but guys, like the way that this lady is putting on a question, it's almost as if she's being soft on the minister. Why are you not saying, the minister, we know that the public health care is overburdened by the illegal immigrants. Why are you not, guys, pushing for the illegal immigrants to get out of this country? This is how you should ask a question to the minister instead of tiptoeing around this issue, because we know the reason why these public health care facilities are overburdened and the reason why these public health care facilities will never have enough resources is because of these people that are jumping the borders and coming into the country. And you should ask the minister and tell the minister, why are you not pushing for these people to get out of this country? But no, this is SABC. They are making a leeway for the minister, making it easy for the minister to answer this question.
But, if we're looking to the issue of overcrowding as well and healthcare services, it's become a controversial issue here in the country. And I wonder if you could talk to us about, these new hospitals, how they're going to be addressing the issue. Perhaps give us a sense of how dire the situation is in regard to overcrowding and why government's now seeking these alternatives to prevent problems for the near future and beyond.
Yeah, well, Lizelle, 86% of the South Africa's population is using private health care.
No, public.
86%. Are using public health care. 86% of the population is using public health care. 14% are people with medical aid and who are well-to-do. They use private hospitals that are well-equipped, as you know. So the 86% that is going to public health hospital, they arrive there to find fewer resources, both human, financial, and other material resources. And that's why there is overcrowding. So the only way to solve that...
No, that is not why it is overcrowded. It is overcrowded because we have a lot of illegal immigrants in this country. And let's play a guess game, guys. Let's play a guess game. Why do our public healthcare facilities do not have enough resources? Why don't we have enough resources in the public healthcare? Let's just take a guess. Because right now, the minister was speaking about 6 new hospitals, that they need to build 6 new hospitals. Instead of putting the money into the hospitals that we already have so that they can be functional, they are saying, no, we are not going to pay attention to these hospitals that we already have, but we want to build more hospitals. This is the solution that these people are coming up with. Building more hospitals when you have a lot of hospitals that are under-resourced. And the minister says that no, in the public hospitals, there are lack of resources, whether human or financial, and this is the reason why there's overcrowding. No, it is overcrowding because of illegal immigrants.
That overcrowding is to give them more resources, not to push the resources to private sector where there are few people. And that's why I was complaining of the 70 billion rand subsidy that is given to all government employees who are on medical aid, including members of parliament, including the judiciary. That means the cream of the crop are the ones who are being subsidized. And I was saying that money should go to help the public sector where 86% of the population is getting their health services and getting overcrowded because of sheer numbers. Even the public protector, when...
I mean, like, Motsoaledi can actually lead by example and actually get rid of his medical aid. As the Minister of Health, why don't you get rid of your medical aid and start going to the public hospitals? And lead by example. You are the minister after all. Lead by example. Because we know the people in parliament, they will never get rid of their medical aid. These people, whenever they seek medical attention, they will go to the private hospitals, despite them working for the government. So you as the minister, if this is what you are pushing for, why are you not leading by an example and saying that, guys, as the Minister of Health, whenever I'm sick, I will not go to the private hospitals, but I will go to the public hospitals? Why don't you lead by example, man?
6% of the population is getting their health services and getting overcrowded because of sheer numbers. Even the public protector went to, I'm sure you might be aware, Lizelle, about the Oranginza Hospital in Gqeberha, in the Eastern Cape. It's always in the news. It's always on your TV, where pregnant women are sleeping on chairs and on the floor and all that. The public protector went there on her own accord to investigate, and she reached the same conclusion as us, that we need to build new district hospitals there to help it, because the overcrowding is because of a large number of people which the hospital simply cannot afford to carry.
But
I mean, like, just listen to the minister, man. Just listen to the minister basically ignoring this issue of illegal immigrants. Totally ignoring the issue of illegal immigrants and trying to make this about the resources, and needing to put more resources into the public health care. It doesn't matter how much money you can pump into the health department. It doesn't matter. As long as you don't deal with the issue of illegal immigrants, you're going to deal with this issue that you are dealing with. And right now, guys, this is what I was talking about. Look over here. 6 academic hospitals to be built. When we have the hospitals, big hospitals, I'm not talking about small hospitals. We have big hospitals that can help a lot of people. But they say, no, we need to build more hospitals, meaning that there is a tender. Somebody got a tender. Somebody got to eat. The comrades have to eat. Because it doesn't make any sense. It doesn't make any sense. Instead of putting that money into the hospitals that we already have, they want to build new hospitals when you have the big hospitals that are under-resourced. And somehow they think that this is a solution that is going to help the people. They think it's a solution that is going to help the people. That's why I say that, guys, every time when I listen to these people speak, I get a headache. Every time when I listen to these people come up with these ridiculous solutions, man, I get a headache. Because I cannot believe that these are the people that are leading this country. These are the people that are trusted to lead these big institutions in this country. This is a mess, man. This is a mess. The public healthcare facilities, if you can get rid of the illegal immigrants, I am telling you today, you get rid of the illegal immigrants and You take the money that is supposed to build these 6 new hospitals and you put that money into the existing public healthcare facilities so that these facilities can have the resources, they can have the machines, they can have the medication, they can hire more doctors and hire more nurses. I'm sure these public healthcare facilities, they can actually work out well fine. But no, the comrades have to eat. So they have to build 6 new hospitals with billions and billions of rands. These are the comrades for you guys. These are the comrades for you. It is absolutely ridiculous, man. It is ridiculous. The so-called Dr. Motsoaledi. It is ridiculous. Insane. That we have to sit here and actually have debates about these issues. I mean, like even a 6-year-old can tell you that, no, take that money and put it into the public healthcare facilities. Simple. But because they want to go around and saying that, no, this is what we have built. This is what we have built. This is what we have built. It is sad, man. It is sad that these are the people that are leading this country. Absolutely sad. What are your thoughts, guys? Please tell me what you think in the comment section. Don't forget to hit that like button and the most important part, subscribe. My name is Thomas Mabaso. I will see you next time. Bye-bye.